A couple of days back, a young male patient, 24 years old, visited the clinic, and he gave me the history that he had a breakup with his girlfriend, and the breakup was pretty hard on him because the relationship was quite long. He was with his girlfriend for like 10 years. They have been together since school days. And after the breakup, the patient had all kind of symptoms. He had sadness of mood, he would cry excessively, he had difficulty in sleeping, and things were not becoming better. So after detailed history and examination, I told him that you are having a major depressive episode and you must take proper treatment, and you should take a combination of medicines and psychotherapy sessions. When I told him that, the patient asked me that, doctor, how would medications help me and how would therapy help me? My problem is that I had a breakup, there was a loss of relationship, and how can a medicine fix that, or how can the therapy fix that? And this is a common question from patients. Many patients who have been having a clear-cut stressor, say relationship problems or breakups or financial losses or job losses, they often ask that how can a medicine or therapy fix loss of a job, or how can medicine or therapy fix the relationship issues? And these patients tend to believe that since it's because of a problem, they don't really have an illness. They don't see depression as an illness. They see it as a response, or they see their symptoms as a response to the life situation. And this viewpoint is not new. In fact, a couple of decades back, even psychiatrists used to divide depression into two types. It was said that there are two types of depression. The first one was called as reactive depression. The reactive depression was believed to be a reaction to some kind of untoward incidents in life. So for example, if somebody had relationship loss or financial loss, and after that he was developing depressive symptoms, it would be diagnosed as reactive depression. It was believed that it is more of a psychological problem and not so much a biological problem. And it was also believed that therapy or counseling is a better treatment modality for the patients with reactive depression. On the other hand, in those patients where there was no clear-cut stressor, there was no clear-cut untoward incidents in life, and if those people develop depression, it was believed that it is more of a biological problem, or something is happening with the chemicals of the brain or the body per se, and it was given the name endogenous depression, more of an internal depression. And it was believed that in patients with endogenous depression, therapy would not be so successful. Rather than that, medications would be the primary modality of treatment. As further research was done, more information was collected, more patients were observed. What scientists and doctors found out was that these two categories, reactive depression and endogenous depression, are arbitrary in nature. These categories have been defined in an arbitrary manner because the symptoms, the treatment response, the course of the illness was quite similar in both the cases. It was almost impossible to differentiate between the two, apart from the fact that one was preceded by a clear-cut stressor and the other was not. So later on, both the categories were merged, and nowadays we don't make this differentiation. We only give the diagnosis of major depressive episode or major depressive disorder. We don't say whether it is reactive or endogenous. And this is what I told that patient, that it does not matter whether the trigger for depressive episode was a relationship loss. Once there are symptoms, we have to make a diagnosis, and once we make a diagnosis, we have to treat it accordingly. Whether it was preceded by the breakup or not does not really matter. So the point to remember, or the take home message of this video is that just because there is something going on in your life, say you are having difficulty with your spouse, say you are having difficulty with your colleague or senior, or say you are having financial disturbances or difficulties, just because there is some problem going on in the life does not mean that depression that is developing secondarily to that or because of that is not a clear-cut illness or is not a proper illness. Many times people tend to say that this is a response to a particular situation, and that's why I don't need a treatment. Medicines cannot help me with that. But that is not true. Irrespective of what is causing it, finally it is a disease, and if there is a disease, it must be treated. I often give this example to my patients that say you develop cold, say you have developed cough, you are having sputum. Now whether that cold developed on its own without any clear cut reason, or whether you got drenched the night before in the rains and after that on the next day in the morning you develop cold, it does not matter. Once you have cold, once you have cough, once you have sputum, you have to be treated. Whether getting drenched in the rain led to that cold and cough, or whether it happened without any clear cut reason, does not really matter, because cough and sputum in itself is a symptom in itself. We have to make a diagnosis and we have to treat it accordingly. So please don't withhold treatment, please don't stop yourself from taking treatment just because you think that there is a clear cut reason for the symptoms.
अगर आपको डिप्रेशन की समस्या है तो आप डॉक्टर प्रवीण त्रिपाठी से सीख सकते हैं कि डिप्रेशन के पेशेंट्स में काउंसलिंग कैसे की जाती है और उन टेक्निक्स को यूज करके डिप्रेशन से बाहर निकलने की जर्नी को शुरू कर सकते हैं। स्क्रीन पर दिए कार्ड को क्लिक करें या फिर डिस्क्रिप्शन में दिए लिंक को क्लिक कर डॉक्टर प्रवीण त्रिपाठी के कोर्स में एनरोल करें।
So guys, our aim is to spread as much information as possible about the psychiatric disorders and sexual disorders, and I hope you were able to get some good information out of this video. Thank you.